Hi, my name is Dr. Misha Marjani. I'm going to be presenting on CBT, Cognitive Behavioral Therapy. Before I get started on the presentation, just want to explain a little bit about what we do, why we do CBT here at Casa Palmera. Primarily, we treat patients with substance use disorders and addictions. However, we do understand that there are a lot of underlying issues related to substance use, and CBT is one of the primary methods of treatment that we use in treating those underlying issues. So with that, let me continue with the presentation. So some of the origins of CBT, it was pioneered by Dr. Aaron Beck back in the 60s. And it was developed as a result of his research on patients that he worked with in working with depression. So what he noticed primarily with these patients was that there was a lot of self-talk going on. There was some self-dialogue. And through this research, he understood the importance of helping patients identify their thought patterns and their thought processes. So what is CBT? CBT is a form of psychotherapy that focuses on dysfunctional thought patterns, dysfunctional emotions, as well as behaviors. And we really look at why these thoughts and behaviors exacerbate and maintain patient psychopathology. It is a more solution-focused approach to treatment, meaning that obviously we do find it important to understand a patient's background, their clinical history, and we do get a lot of that information from patients. However, we're much more solution-focused, so we're always focused on the present and what the symptoms are that patients are presenting with. So it is very much problem-focused and goal-oriented. So we do identify a lot of harmful thoughts that patients are experiencing, and we assess whether their thoughts are an accurate depiction of what reality is. If it's not, that's where we want to help them really challenge those thoughts. Also, along with CBT goes a lot of teaching coping skills, various coping skills for maintaining sobriety as well as helping them with those underlying issues that I mentioned earlier. So the definition of CBT, C stands for cognitive, and cognitive or cognitions mean our thoughts, the ways of thinking. Different people think about different situations differently. So in any one situation, there might be 5 different sets of beliefs, which then lead to 5 different sets of emotions and different sets of behaviors as a result. The B part stands for behaviors or actions. So it's what patients see themselves doing. It's the kinds of behaviors that they engage in. Sometimes it could be subtle things like avoidance or escape behaviors. So helping them to identify what those maladaptive behaviors are. So this is the CBT model. So in any situation, you can see that there's a certain set of thoughts, emotions, behaviors, and physiological sensations. In CBT, we know that we can't directly change people's emotions. You feel however way that you feel. We can't change physiological sensations as well. You experience certain physical sensations that come up as a result of your emotions. You can change your behaviors directly. That's what we call behavioral activation. So for example, if you're feeling depressed and you don't feel like getting out of bed, we can tell you, hey, let's get out of bed anyways, knowing that if you change the way that you're behaving, that can actually help improve your mood as well. But really in CBT, we're much more focused on targeting our thoughts and our thought patterns. We know that if we change the way we think, we can change the way that we feel, and as a result, change the way we behave. So I have a couple examples here. So in this example, this is something we actually find very commonly with patients who come to Casa Palmera. Patients who come into treatment for the very first time, if they've never had any sort of substance abuse or mental health treatment before. Person A might have the thought, well, what if this doesn't work for me? What if I relapse? This is too hard. What if I don't understand the concepts? What if I can't apply it to my own situation? So someone that might be having this sort of thought pattern might be experiencing a lot of anxiety, a lot of fear. They might feel hopeless. They might feel helpless. And if they're experiencing those emotions, it's likely that they might withdraw from other people. They might not be as motivated to participate in groups or in individual therapy. They might be less likely to complete homework assignments that therapists assign for them. In the same exact situation, though, coming to treatment for the first time, person B might have the thoughts that I was able to at least finally get myself to treatment, even for the first time. I haven't tried this yet, but I can approach it with an open mind, knowing that it's possible that it could work for me. They might have the thought that, well, I don't have any evidence that this won't work, so why don't I give it a try? So that sort of person with that thinking might feel more hopeful about being in treatment. They might even feel excited. They might feel some relief at the fact that they're actually in treatment. And somebody who's experiencing those sort of emotions is probably more likely to participate in treatment, feel somewhat motivated. They might be more likely to complete homework assignments. So you can see in the same exact situation of coming to treatment for the first time, two very different sets of thoughts lead to two very different sets of emotions and behaviors. So why use CBT? Cognitive behavioral therapy is the most widely used evidence-based practice for improving a lot of different mental health conditions. It is used for treating underlying issues that are related to addiction, like I mentioned earlier, things like depression, anxiety, grief and loss, trauma. We know these things to be significant factors in why people use serious substances. CBT can also be an effective form of treatment in brief periods of time. So it has been shown to be effective even in as little as 5 sessions. So here, unfortunately, because we don't get a whole lot of time with our patients, we might get anywhere from 2 to 3 up to 5 or 6 sessions with our patients. It is effective in at least doing that sort of work within those sessions. CBT is also used for relapse prevention of mental health symptoms. So someone who might be experiencing bipolar symptoms, it can be helpful in helping them to identify the early warning signs of a manic episode or a depressive episode in order to help them avoid falling into that. CBT can also be helpful for learning different coping skills for dealing with stressful life situations. So for anyone, really, CBT can be helpful, not just for patients, but if people are having issues with relationships or friendships or interpersonal conflicts, CBT can be helpful in, again, helping them to identify what those thought patterns are that they're engaging in. So CBT can also be helpful in managing chronic symptoms. A lot of that would be related to practicing mindfulness skills and acceptance of pain and helping them to view their experience of pain a little bit differently. So I did want to go over a little bit of the empirical research behind CBT. I included a graph here as well. So like I said earlier, CBT is the most extensively researched form of psychotherapy and has been shown to be effective in over 2,000 research studies. There is ongoing adaptation of CBT for a wider range of disorders. It's helpful for things like depression, different anxiety disorders, trauma. However, through research, we know that the combination of medication and psychotherapy is the most helpful in treating a lot of disorders. This graph here shows that CBT is helpful in things like panic, generalized anxiety disorder, social anxiety disorder, PTSD, phobias, and OCD. And you might be able to tell from the graph here that cognitive behavioral therapy is actually more effective than just medication or traditional talk therapy. And what we know is that oftentimes when patients discontinue medication, there's actually a significantly higher relapse rate as well. So we want to make sure that patients are getting the full benefit of Casa Palmera by combining medication and psychotherapy together. So like I said earlier, there's different applications for CBT, a wide range of disorders that it has been shown to be effective for. These include mood disorders such as major depression, bipolar disorder, persistent depressive disorder, what used to be called dysthymia, which is long-term depression. It's also effective for a lot of different anxiety disorders such as generalized anxiety, social anxiety or social phobia, panic disorder, obsessive compulsive disorder, as well as post-traumatic stress disorder. It is helpful in addiction as well and a lot of different eating disorders, and there is ongoing research for CBT in areas like schizophrenia as well. What we know about CBT is that there are different hierarchies of cognitions being our thoughts, different levels of thinking. So the very first level is what we call our automatic thoughts or images. Those are the most easily accessible, most readily accessible. If you simply just ask yourself what's going through my mind, you'll be able to access those thoughts. We have hundreds, thousands of thoughts per day, and we want to pay attention to the ones that keep coming back that lead to some sort of depression or some anxiety or worry. If we dig a little bit deeper, we get to what's called our intermediate beliefs. These include our attitudes, our rules, the assumptions that we make and that we live according to in life. Oftentimes, if you're stuck in depression or stuck in anxiety, likely there's a lot of irrational thinking or negative thinking going on. So again, helping to identify what those assumptions are. Assumptions might be things like, if I say no to other people, then they might reject me. If I were to be my genuine self, then people won't accept me. So those could be common irrational assumptions that people make about their way of living. So we want to help patients to test those assumptions to figure out if any of it is an accurate depiction of reality, or again, if it's irrational. The very bottom is what we call our core beliefs. So this is the very deepest layer of thinking, really. We believe that if we don't help patients identify and challenge their negative core beliefs, they'll still be at some risk of relapse because, for example, if their core belief about themselves is that they're unlovable or that they're not worthy, then that's constantly how they'll be looking at themselves. That's how they'll be viewing themselves. And that can have an effect on their mental health and their mood. So we want to help them to identify what those core beliefs are. Some examples I have here of what automatic thoughts patients might experience would be things like, I'll never get better, this is too hard, what's the point? I can't cope with my difficult emotions, I won't be able to handle it. If I'm feeling too much anxiety, I'm not going to be able to get through it. Examples of intermediate beliefs might be things like, if I don't experience immediate relief, then I'm never going to get better. I should be feeling better every day that passes. If you're engaging a lot of should statements, that's a good sign that you have some sort of negative belief about how things should be. Examples of core beliefs might be, I am hopeless, I am weak, the future is bleak, the world is unfair, the world is unjust. So again, helping patients to identify what those core beliefs are about themselves. Core beliefs could be developed as early as age 4 or 5, and over years and even decades for some patients, they validate that core belief and they look for certain evidence that validates that core belief. So it does take time to challenge that core belief and to really strengthen a new, more adaptive one. However, it's possible through daily practices, daily exercises that we have patients do here. Cognitive behavioral therapy for depression, what that entails is helping patients challenge negative thought patterns, what we call cognitive distortions. Cognitive distortions are irrational or exaggerated ways of thinking. Some examples of cognitive distortions are all or nothing thinking, fortune telling, mind reading, which I'll get into in a little bit. So really what we want to do, like I mentioned earlier, is we want to help patients identify those more alternative, more balanced core beliefs about themselves. So for example, if their old core belief is, I am unworthy, what we want to help strengthen about themselves is that they are worthy. Oftentimes the sort of exercises that I have my patients do is even simply just listing out reasons to believe why I am worthy and adding to that list, adding 2 to 3 items on that list every day. And this really takes a certain level of commitment from patients to understand that and to recognize every single time that their mind goes back to that negative core belief and to commit themselves to working on the new core belief. Another strategy we use for depression in CBT is increasing contact with positively rewarding activities. So like I mentioned earlier, again, someone who might be depressed might not feel like getting out of bed, they might not feel like interacting with people, but it's helping them to figure out how do they force themselves to do that despite the mood that they're in. And we know that, again, the more positive activities that patients engage in, the more likely it is to improve their mood. I added a quote here. It says, don't believe everything you think, because again, we have thousands of thoughts a day, and if someone is feeling depressed, it's likely they're having a lot of negative thoughts or a lot of irrational thoughts. So I'm constantly telling our patients, hey, let's try to differentiate between what the thought is and what actual fact is, what reality is. Some examples of cognitive distortions or irrational ways of thinking are black and white thinking or all or nothing thinking. An example might be, if I don't do things perfectly, then I'm a failure. Often that sort of belief system might lead to a lot of avoidance of starting tasks because, again, if I can't do it perfectly, why try? Another cognitive distortion would be using should statements, should or ought or must. It's terrible that I made a mistake, I should always do my best. I should never make a mistake. I should never fail at anything. So these sort of should statements, again, lead to a lot of anxiety, lead to sadness. There is a lot of association between depression and perfectionism, for example. Oftentimes people who engage in perfectionistic tendencies feel the need to, constantly try to do better. But obviously, it's not always possible to do things perfectly. So that leads to a lot of anxiety and a lot of depression. Another very common cognitive distortion is what we call jumping to conclusions or catastrophizing. This can include things like mind reading and fortune telling. So mind reading, oftentimes we see this with patients who experience social anxiety. So it's imagining that you know what others are thinking. And one example might be the thought, they don't like me, or they're judging me, or they must think I'm weak or I'm a loser. So, again, helping patients to recognize when they are engaging in mind reading, help them challenge some of that, know that they can't possibly know what others are thinking. Another cognitive distortion is fortune telling. We see this pretty commonly with patients who struggle with generalized anxiety disorder. It's this idea that you predict things will turn out badly. And oftentimes it is badly, it's not in a positive way. So an example of that might be, I'm going to fail my exam, or I'm going to lose my job, or I'm going to relapse. So again, helping patients to recognize when they're constantly living in the future and letting that go and helping them to come back on focusing on the present. Some strategies for cognitive behavioral therapy in treating anxiety include helping patients understand that oftentimes they do overestimate the probability of something bad happening. So again, for example, if my fear is, what if I lose my job, and I have a lot of anxiety about that, it's looking at the evidence of, well, what reason do I have to believe that may happen or that may not happen? Often what I'll hear from patients is, well, actually I got a pretty good review recently, or I'm never late, or I haven't gotten any bad remarks from my boss, so I don't really have enough reason to believe that it's likely to happen. So again, having them look at the evidence behind that. Another thing that we see patients commonly do is underestimate their ability to cope with something happening. A lot of times if a patient is experiencing a lot of anxiety, they feel as though the anxiety is too intense and that they don't have the mechanism to really manage that anxiety or to self-soothe. So I consistently try to encourage my patients to see if they can sit in that anxiety, to see it kind of hit them like a wave, and then oftentimes it subsides and to know that no emotion is really permanent. Most of our emotions are temporary, they come and they go. But to help them to understand that they are able to cope with that anxiety. Again, anxiety being one of the main, underlying issues related to addiction, it's important that patients really learn how to manage in a healthy way. Another technique is we help patients to develop adaptive responses for worry. So again, if someone is struggling with generalized anxiety disorder, there is a tendency to worry a lot about different aspects of life. And so to understand, first of all, well, if that worst thing were to come true, how can they cope with it? So that's one very effective strategy, is what would they do? Who would they reach out to for support? What specific steps would they take in order to cope in a healthy way? And oftentimes we see that when patients kind of go through those steps and really take that time to come up with those adaptive responses, it does actually help reduce some of that anxiety. So one common theme that we see in the research on generalized anxiety is this inability to accept uncertainty in life. So one thing we do know about life is that there are a lot of uncertainties. We simply don't know a lot. There's a lot of fear of unknown that's pretty common to a lot of people. So the two magical words that we tell patients to look out for is what if. So someone who worries consistently engages in a lot of what if thinking. What if I relapse? What if I don't get better? What if I continue to feel this way? What if I get worse? So again, helping patients to recognize when they're engaging in that. One thing that we know is effective is teaching patients to recognize that, let that worry thought go, and to simply refocus back on the present task, whatever task is at hand. And mindfulness is another great technique to help them do that. Exposure therapy for anxiety has been shown to be very effective as well. So sometimes I'll take the opportunity to have patients expose themselves to certain situations that may cause anxiety, such as sharing about themselves in group therapy, or participating when they don't feel comfortable, when they have anxiety, sharing an answer or asking questions. So to repeatedly expose themselves to those situations can reduce anxiety. And really, avoidance is a big issue too when it comes to anxiety. Obviously, most people want to or have the natural tendency to avoid any sort of discomfort and any anxiety or stress that they might be feeling. So reducing that level of avoidance or level of escape is crucial in helping patients manage anxiety in a healthy way. Cognitive behavioral therapy for addiction really involves looking at the causes and consequences of their behaviors. So some of the things that we help patients do is, one, recognize the circumstances that lead to patients using their substance or their substance of choice, their drug of choice. We want to help them to avoid or remove themselves from any trigger situations that exist whenever that's possible. And we also want to help them learn how to cope by using different CBT techniques to manage their negative thoughts and emotions that often lead them to substance use. So again, coping with various emotions that have to do with depression or anxiety or grief and loss and trauma. We want to help patients identify certain triggers that cause them to use. And of course, always coming up with a relapse prevention plan. So this includes having a sober support system, knowing who that they're going to reach out to, what they might do if they have a craving or an urge to use, along with a lot of different things. I've gotten the question from family members in the past of how CBT is associated with the 12 steps. Here at Casa Palmera, we do go by the 12-step program. So some of the things we've noticed, for example, step 1, we admitted we were powerless over alcohol and that our lives had become unmanageable. So one translation of that when it comes to CBT might be that we accept the compulsive nature of our addiction and its symptoms, and we detail the costs and consequences of our addictive behaviors. So again, CBT always brings the focus back on what the costs and consequences are, looking at the thought patterns behind them, and looking at the addictive behaviors that exist when we talk about substance use. And so you can go through each of the steps and kind of see how each of them are associated with their CBT translation. So I included this quote because I think it is important when we're talking about CBT and substance use. It says, when an addicted person understands why they feel or act a certain way and how those feelings and actions lead to substance use, they are better equipped to overcome their addiction. So really here at Casa Palmera, we're focused on helping patients to get as equipped as possible to have the coping skills they need to understand themselves and their addiction better, so that we can reduce the likelihood of relapse. This is the end of the slides, but I did include a number of resources that patients and family members find useful. Different ones such as Mind Over Mood, which is very helpful. It's a self-help book, mainly addressing depression. Generalized Anxiety Workbook is great for patients who suffer from anxiety. So I put a little different ones. I did include a TED Talk on CBT, Cognitive Behavioral Therapy, by Dr. David Burns. And he's the one that created this Feeling Good handbook. It's on its 2nd edition. But I hope you find that as a useful tool as well. But that is the end of my presentation. I hope you enjoyed it. Thank you.